Service will have a diabetes clinic where you can go for care during pre-pregnancy and throughout your pregnancy. If you're not currently seeing an endocrinologist or you don't know where to find one, simply talk to your GP or call the diabetes department at your nearest large hospital.
Nice to see you again.
Nice to see you too.
Good. How are things going with the pregnancy?
Good, actually. Everything seems fine and under control.
Good, fantastic. How many weeks pregnant are you now?
31.
31,
Yeah.
okay. There are a number of things that women with type 2 diabetes can do when they're planning to have a baby. Probably one of the most important things is to make sure that their blood glucose levels are well controlled, with their HbA1c, if possible, within the normal range.
And I feel fine.
The other thing that's really important is to make sure that their weight is as close to the normal range as possible. And thirdly, it's important that their complication screening for diabetes is up to date. Well, these blood glucose levels are excellent. I think you're doing a really good job there with managing your diabetes.
Good.
Excellent. And what about your exercise program?
That's a bit difficult at the moment.
It's important to talk about your exercise plan with your healthcare team. Sometimes there are reasons to do with your pregnancy that may mean you have to make changes to your exercise program.
Looks like everything's going really well right now.
Thank you.
The normal range for an HbA1c is less than 6%. If a woman can get this reading below that before she gets pregnant, that's ideal. It's important to have good blood glucose control around the time a woman conceives because it reduces the risk of miscarriage and of birth defects. How much Protophane are you taking at the moment?
10.
10 at night.
At night, yeah.
Many women with type 2 diabetes need insulin during pregnancy to keep their blood glucose levels within target. It's important that they see their diabetes educator and their endocrinologist frequently so their insulin doses can be adjusted. If a woman becomes pregnant when she hasn't planned to, my advice is don't panic, but come to see us as soon as she can so we can work quickly to get her blood glucose levels under control. It's important that she doesn't stop her diabetes medications until she's seen her diabetes team.
I am looking forward to having the baby, and today I found out through the doctor that it was going to be normal delivery, which was a positive thing. So I know I'm having a little girl and I've got a son, so I think it would be nice to have a son and a daughter as well.
This one, my second one is boy, yes. At first I want a girl, but a boy is okay. Because I have a boy first son, yeah. So I'm thinking having another girl maybe.
So we're up to almost 39 weeks.
39, yeah. Tomorrow, 39 weeks.
Tomorrow, so one more week to go.
Yes.
Good. And baby's moving well?
Yes, moving all day, all night.
We like to see a woman with type 2 diabetes as early as possible in her pregnancy, really as soon as she knows that she's pregnant, so that we can do all the initial screening tests. Then we will see her more frequently, particularly to watch how her blood sugar control is getting on. Any soreness? After around 26, 28 weeks, we do see the women more frequently than we see women who don't have diabetes. The frequency of visits really just depends on how the baby is growing, if she's had any blood pressure problems. Good. And now just a little bit more feeling. A pair of feet out here. Have you felt the baby's foot? Just here. You feel a little foot? There are two reasons why it is so important that the sugar control should be as good as possible before a woman gets pregnant and in the very early parts of pregnancy. Now, have you got your blood sugars there? Can I just have a look? First is the risk of abnormalities. That is where the heart can have problems in its development or the kidneys can have problems. The other risk is if the sugar control is not good around the time she gets pregnant and in the early part of pregnancy, she's at greater risk of miscarriage. And they've talked to you about what you do before you come in for your Caesar?
Yes,
about when
okay.
you stop? Women with type 2 diabetes can certainly plan and hope to have a normal vaginal delivery. There are times when, because it's a big baby, that can become more difficult, that they may require delivery by caesarean section.
I was told I had to have a Caesar because I had an operation a couple of years ago, and because of my age, I was a little bit older, and so we decided to have the Caesar.
Oh, the feeling that you get when the baby's born is just remarkable. You just look in that baby's eyes and it just looks at you and you fall in love. You really do. You fall in love with the baby.
I couldn't believe she was mine. It was just beautiful. It was just gorgeous.
So if you have type 2 diabetes and you want to have a baby, remember, make sure while you're getting your blood sugars under control, you use contraception. This gives you the time to be fully prepared for having a baby. Talk to your GP about a referral to a diabetes clinic at a maternity hospital or to an endocrinologist well before you want to have a baby. Test regularly to make sure you have well-controlled blood sugars before you conceive and while you're pregnant. Make changes to your diet to help lower your blood sugars before you conceive and during pregnancy. Before you get pregnant and during the pregnancy, walking will help lower your blood sugars. Try to walk 30 minutes a day at least 4 to 5 times a week. Take 5 milligrams of folate for at least a month before you start to conceive, and then the first 3 months of your pregnancy.
We love coming up here. We spend a lot of time with my mum and dad, and nephews and nieces, and we have a good time. It took me a few years to fall pregnant because I had a few problems with operations, miscarrying, but now it's all great. Bellamia, she's beautiful. I love her. Everyone loves her. And it's the best thing that ever happened to me. I'd like to have another baby if I can. I have to use insulin again, which that's fine. So I've got to just try to fall pregnant now and control my eating, exercise as much as we can. My family is amazing with Bella. They spoil her because everyone waited for her for so many years and now everyone's just wrapped. Breastfeeding has been fantastic. I love it. She's been a good girl. It's been wonderful, actually.
I recommend to my patients that they breastfeed their babies if they can. They will need to talk to their doctors about the best way of managing their blood glucose levels during this time.
Once you've had the baby, it's important to maintain the lifestyle changes you've made. Make sure you keep walking, eat the right foods, and test your blood sugars regularly. Remember, you're doing this for yourself and for your family.
For women who do have type 2 diabetes during their pregnancy, I think it's very important for them to understand